Welcome back to Sasha Said What She Said, where real life, medical bills, health insurance confusion, Medicare, job benefits, family drama, and the fine print finally get explained without making your head hurt. Before we jump in, make sure you like, share, and comment. Send this to somebody turning 65, helping a parent with Medicare, or sitting at the kitchen table staring at a Medicare letter like it came with homework. Because today, baby, we are making Medicare simple.
Thank God, because Medicare has more parts than a family reunion. Part A, Part B, Part C, Part D. I'm looking for Part, please explain this before I cry.
Exactly. Medicare can feel confusing at first, but once you understand what each part does, it starts making more sense. Now, let me say this clearly. This episode is for educational purposes only. Medicare choices can affect your doctors, prescriptions, costs, networks, and coverage. Always review your options and speak with a licensed Medicare professional, Social Security, Medicare, or a trusted benefits counselor before making decisions.
Translation. Don't just pick a plan because the commercial had smiling grandparents and a free grocery card.
Please don't. We are not choosing health coverage based on vibes and jingles. So let's start with the basics. Medicare is health insurance mainly for people age 65 and older. Some people under 65 may also qualify if they have certain disabilities or medical conditions.
So Medicare is not just old people insurance?
Correct. Most people think of Medicare when someone turns 65, but some younger people can qualify through disability, end-stage renal disease, or ALS. Today, we're going to talk about two case studies, someone turning 65 and someone who qualifies through disability. But first, let's break down the famous Medicare alphabet. Part A, Part B, Part C, Part D.
Sounds like Medicare went to school and brought the whole alphabet home.
It really did. Let's start with Medicare Part A. Part A is commonly known as hospital insurance. It helps with things like inpatient hospital care, skilled nursing facility care, hospice care, and some home health care, depending on the situation.
So Part A is the hospital side.
Yes, think A for admitted. If you are admitted to the hospital as an inpatient, Part A may come into play.
Okay, A for admitted. I can remember that.
Now, Medicare Part B is medical insurance. Part B helps with things like doctor visits, outpatient care, preventive services, lab work, some medical equipment, and other medically necessary services.
So Part B is for the doctor, outpatient care, and regular medical stuff.
Exactly. Think B for basic doctor business.
That is not official, but it works.
Works for today. Now, parts A and B together are called Original Medicare. Original Medicare is managed by the federal government. With Original Medicare, people can usually see any doctor or hospital in the U.S. that accepts Medicare. But Original Medicare does not cover everything, and people may still have deductibles, co-insurance, and other out-of-pocket costs.
So Medicare is helpful, but it is not a magic wand.
No, ma'am. Medicare helps, but it still has rules, costs, and gaps. Now let's talk about Medicare Part C. Part C is also called Medicare Advantage. Medicare Advantage plans are offered by private insurance companies approved by Medicare. These plans are another way to receive Medicare benefits. You still must have Part A and Part B to join a Medicare Advantage plan.
So Part C is not extra seasoning on top of Original Medicare.
Not exactly. It is a different way to receive Medicare coverage. Many Medicare Advantage plans include prescription drug coverage and may include extra benefits like dental, vision, hearing, fitness, transportation, or other benefits, depending on the plan. But here is the important part. Medicare Advantage plans often have networks, co-pays, rules, and service areas. So you need to check your doctors, prescriptions, hospitals, and costs before choosing.
Because extra benefits sound nice until your doctor says, I'm not in that network.
Exactly. Always check before you switch. Now let's talk about Medicare Part D. Part D is prescription drug coverage. It helps cover the cost of medications. You can get Part D as a separate prescription drug plan if you have original Medicare, or it may be included in a Medicare Advantage plan.
So D is for drugs?
Prescription drugs, yes. And this is very important because people need to make sure their medications are covered. Check the pharmacy network and look at the plan's drug list.
Because one medication not being covered can make your wallet gasp.
Absolutely. Now, let's put this into a real case study. Case study 1. Mrs. Carroll turns 65. Meet Mrs. Carroll. Mrs. Carroll is turning 65 in August. She still works part-time, helps with her grandkids, and has a folder full of mail that says Medicare on it. Thank God, because Medicare has more parts than a family reunion. Part A, Part B, Part C, Part D. I'm looking for Part, please explain this before I cry.
Oh, so Medicare already started sending love letters?
Yes, Medicare mail will find you. It will come to your mailbox like it pays rent. Mrs. Carroll says, I'm turning 65, but I don't know what to do first. So here's the process. Generally, a person's first chance to sign up for Medicare around age 65 is called the initial enrollment period. It lasts 7 months. It starts 3 months before the month you turn 65, includes your birthday month, and ends 3 months after your birthday month.
So she should not wait until the birthday cake is gone.
Exactly. Start early. Don't wait until you're blowing out candles and trying to read Medicare letters at the same time. Now, whether Mrs. Carroll has to actively sign up depends on whether she is already receiving Social Security benefits before age 65. If she is already receiving Social Security benefits early enough, she may be automatically enrolled in Part A and Part B, and her Medicare card may come in the mail before coverage starts. But if she is not receiving Social Security benefits yet, she usually needs to sign up through Social Security.
So some people get Medicare automatically, and some people have to raise their hand and say, I'm here?
Exactly. Mrs. Carroll can apply online through Social Security, call Social Security, or contact her local Social Security office. If she worked for the railroad, she may go through the Railroad Retirement Board. Once she gets Part A and Part B, she has decisions to make. Does she want original Medicare? Does she need a Part D prescription drug plan? Does she want to look at Medigap, also called Medicare Supplement Insurance? Or does she want to compare Medicare Advantage plans?
Wait, Medigap and Medicare Advantage are not the same thing?
Correct. That's important. Medigap is supplemental insurance that helps pay some costs with original Medicare, like certain deductibles, co-pays, or coinsurance. Medicare Advantage is Part C, a different way to get Medicare benefits through a private plan.
So don't mix those up.
Please don't. They are different. Now, Mrs. Carroll also needs to check her prescriptions, doctors, hospitals, budget, travel habits, and whether she wants provider flexibility or a plan network.
So Medicare is not just pick the cheapest plan.
No, cheapest is not always best. Best is what fits your health, doctors, medications, budget, and lifestyle. Now let's move to case study number 2. Case study 2. David qualifies through disability. Meet David. David is 52. He had a serious health condition and was approved for Social Security disability benefits. He is not 65, but he may still qualify for Medicare after receiving disability benefits for a certain period.
So he doesn't have to wait until 65?
Correct. Some people under 65 can qualify for Medicare because of disability. In many cases, if someone is receiving Social Security disability benefits, Medicare starts automatically after 24 months of disability benefits.
So David applies for disability through Social Security first?
Yes, the disability process starts with Social Security. A person may apply for disability benefits through Social Security online, by phone, or through a local Social Security office. If approved, and after the required waiting period, Medicare may begin automatically.
So David is not applying for Medicare first. He's applying for disability benefits, and Medicare may come later if he qualifies.
Exactly. That's the general path for many disability-based cases. Now, David receives his Medicare card. He sees Part A and Part B. He says, "Okay, now what?" Same thing as Mrs. Carroll. He needs to understand his options. Does he keep original Medicare? Does he need Part D for prescriptions? Does he qualify for Medicaid or extra help? Does he compare Medicare Advantage plans? Does he need help understanding costs?
Because being disabled can already be stressful. Then here comes Medicare with choices, letters, and deadlines.
Exactly. That's why people need help before they miss deadlines or choose a plan that doesn't match their doctors or medications. Now let's make the Medicare part simple one more time. Part A is hospital insurance. Think inpatient hospital care. Part B is medical insurance. Think doctors, outpatient care, preventive care, and medical services. Part C is Medicare Advantage. It is another way to receive Medicare benefits through a private plan, and you must have Part A and Part B to join. Part D is prescription drug coverage.
A is hospital, B is doctor, C is advantage, D is drugs.
Look at you.
I'm Medicare ready now. Well, almost.
Almost, because now we need to talk about the big mistakes. Mistake number one, assuming Medicare covers everything. It does not. Medicare is helpful, but people can still have premiums, deductibles, copays, coinsurance, drug costs, networks, and uncovered services depending on their coverage. Mistake number two, ignoring prescription drug coverage. Even if you do not take many medications now, you need to understand Part D and drug coverage rules because late penalties can happen if you go too long without creditable drug coverage. Mistake number three, picking a plan without checking doctors. Do not assume your doctor takes every Medicare plan. Mistake number four, picking a plan without checking prescriptions. Every plan may cover medications differently. Mistake number five, waiting too long to ask questions.
Can I add a bonus question?
Always.
Who can explain this without making me feel like I failed a government exam?
That is a real question. You can contact Medicare, Social Security, SHIP, or a licensed Medicare professional. SHIP offers free health insurance counseling in your state, and licensed professionals can help explain plan options.
Because people need help, not shame.
Exactly. Medicare can be confusing, but confusion does not mean you are not smart. It just means nobody explained it clearly yet. So whether you are turning 65 like Mrs. Carroll or qualifying through disability like David, the goal is the same. Understand the parts, know your timeline, compare your options, and ask questions before making decisions. This has been Sasha Said What She Said, where we laugh, learn, and talk about the fine print before the bill starts acting brand new. Before we go, make sure you like, share, and comment. Tell me, are you turning 65, helping a parent, or trying to understand Medicare for yourself? And remember, Medicare has parts, rules, and deadlines. But baby, once somebody explains it right, it does not have to feel like alphabet soup with a side of stress.